I've been a part of the PALTmed board since 2019, and it has been such a rewarding experience for me. In the beginning, really getting to understand how the board functions and being able to hear all the different perspectives in our space, different from a geographic locations to different modes of care. It was so eye-opening. And it was also being able to work with people I admire and respect, hearing their ideas and the rich conversation in the room. As I gained more experience, I've been so grateful to add to the conversation and help to work to integrate these different perspectives into a cohesive strategy for PultMed. It's always been a group effort, and it's been really exciting. As a PultMed board, we have been really intentional in bringing different ideas and opinions into the conversation, really inviting them in. But one of the best learning experiences is when things change, which has been really the norm for the past couple of years. Learning how we can pivot as a board and an association and evolve to better serve our members. I definitely feel that I'm a better provider and leader from this experience, and I have a broader perspective that has been incredibly valuable. I'm richer because of the company I keep on the PultMed board and from working with the PultMed staff. Things are changing really quickly, both nationally and specifically in post-acute and long-term care. We are navigating intense workforce challenges, shifting regulatory expectations, and evolving payment and practice models. But as a board, we've been monitoring these trends and we are prepared to adjust, educate, and make an impact. We've been really intentional in creating a strategic plan that looks forward as post-acute and long-term care evolves and noting which trends are building and what direction they're going. I see our most important challenge is to ensure that we are meeting our members' needs in this moment, ensuring that we have information we need to be excellent navigators. We not only have up-to-date clinical knowledge, but an understanding of our landscape, our choices, and the challenges that lie ahead. Preparing members clinically, financially, politically, and ensuring they have knowledge of different workforce choices are the primary goals for this year. And being able to pivot, respond, and influence these areas in post-acute and long-term care continuum is a top priority. Assisted living is a great example of the opportunities that PultMed has to establish the expertise and the standard of care for providers practicing in this rapidly growing residential care area. One of the main messages I wanted to convey is our work is essential and PultMed has your back. We care for the most complicated and expensive patients in our society. We should have someone rooting for us, and PultMed is that voice. We are stronger and wiser together. PultMed will continue to provide the expertise and education you need and amplify our value and impact both nationally and right where you stand today. I am so excited for this opportunity. The PultMed board is dedicated to being intentional in our advocacy and in our collaboration. We are a team sport. Physicians, nurse practitioners, and physician associates all benefit our patients when we work together. There's not one group of clinicians that can do this work alone. We need each other, and we provide better care together. PultMed can lead this conversation and promote this team approach as being the best practice. I am so excited about our collaboration with our colleagues at GAPNA to amplify this conversation. Yes, my gratitude. Being part of this community has been the greatest gift of my professional life. Like Dave Logan talked about in his keynote address at the PultMed annual conference last month, we are a tribe, and I'm so honored to be a part of this remarkable community. I'm really optimistic that with the guidance of our PultMed board and the input from our chapters and our members, the future of post-acute and long-term care medicine is bright. I see so many opportunities for us to elevate and amplify post-acute and long-term care medicine. and we are ready for the challenge.